Hello guys, welcome back. Hope you all are doing absolutely fine. So we'll continue with our general toxicology series with our next important short note, general treatment of poisoning. Very important from the view of examination. General treatment of poisoning. Aim: to remove the unabsorbed poison, to treat and excrete the absorbed poison. Objectives and steps of treatment: removal of unabsorbed poison, use of antidote, elimination of absorbed poison, symptomatic treatment, general care of the patient. Before starting the treatment, proper maintenance of ABCD, airway, breathing, circulation and depression is taken note of. Removal of unabsorbed poison. This depends upon the route of administration of poison. Inhaled poison: remove the patient to open atmosphere, ensure clear airway, artificial respiration and oxygenation. Injected poisons and snake bite: use of tourniquet, incision and suction. Ice packs may be applied. Contact poisoning: through skin, wounds and natural orifices, wash the area with water or soap and water. Ingested poisons: induction of vomiting, gastric lavage. Induction of vomiting. Indications: any ingested poison within 4 to 6 hours. Contraindications: corrosives except carbolic acid, convulsions, coma, children, petroleum distillates, cardiorespiratory diseases, pregnancy. Methods: vomiting can be induced by mechanical irritation in the throat with finger or any linear object, by using emetic agents, example plain warm water, weak solutions of copper sulfate, mustard powder 15 to 20 grams in 1 glass of water, common salt 15 to 20 grams in 1 glass of water, or salt and mustard oil, zinc sulfate 1 to 2 grams in 1 glass of water, ammonium carbonate 1 to 2 grams in 1 glass of water, ipecac containing emetine 1 to 2 grams with 1 glass of water, or 30 ml syrup. It is most commonly used emetic. It stimulates sensory receptors in GIT, chemoreceptors and vomiting centers in medulla. Apomorphine hydrochloride is a selective vomiting agent given 6 mg subcutaneously, followed by naloxone 0.4 mg intramuscularly or intravenously. To counteract the respiratory depression produced by apomorphine, it is a contraindicated in coma and respiratory depression. Because of high risk, emetics other than ipecac or apomorphine should not be used. Gastric lavage. Indication: any ingested poison within 4 to 6 hours, morphine injected is excreted in stomach. Contraindications. The absolute contraindication for gastric lavage is corrosives except carbolic acid. In the following situations, gastric lavage can be done with precautions: convulsions, anesthetics or sedatives. Children: use a tube of smaller diameter, example Ryle's tube or rubber catheter. Coma and petroleum distillates. After cuffed intubations, stomach contents are removed by nasogastric tube, gastric lavage tube, Boas or Eval's tube. It is 1 to 1.5 meter long, 12.7 mm broad, rubber tube, thick enough to pass without inking, and has the following parts: funnel end, mouth end, to pour in fluid and to take out fluid after lavage. Suction bulb, sometimes absent, to force open the perforations if blocked by food part material, to take out fluid if siphon action fails. Lower rounded perforated end, stomach end, is rounded to avoid damage to the GIT during its passage. Here we make a diagram of it, which is very simple. You simply make a conical structure and a long tube with a mouth gag and different parts. I would like to, okay, I'll show you one picture. Rubber tubing is marked at 40 cm, 50 cm and 60 cm. Mouth gag is a wooden structure and has a central large hole for the passage of rubber tube. One end is pointed to help open the clenched teeth. Two sides holes to enable tie a thread to the head of the patient in case the patient is violent. Precautions. Obtain consent for treatment. The patient should be semi-prone or prone to the left side. Head should be lower than hips. Ensure clear airway. Dentures, if any, should be removed. The mouth gag should always be used. Ensure that the tube is in stomach only. The first washing should be within the plain water and using only 100 to 200 ml of water. Continue stomach wash till the color of ingoing and outgoing fluid is same. In absence of a gastric lavage tube, any rubber tube and a glass funnel can be used. Procedure. After positioning the patient, the teeth are opened and the mouth gag is placed in them. The lower end of the tube is lubricated with water, soap, milk, liquid, paraffin or castor oil and is passed through the opening of the mouth gag till the 50 cm mark, ensuring that the tube is passing to the stomach. In case it enters the respiratory passages, cough reflex start. Hissing sounds heard at funnel end. Air bubbles seen on dipping the funnel end in water. To confirm the tube to be in stomach, air is blown from the funnel end and is auscultated at the area of stomach. The first washing is done with fresh water, small amount only used 200 to 200 ml to avoid sweeping forward of the poison into the intestines. Later, lavage is done with plain warm water or KMnO4 solution, that is 1 gram per 1 liter of the body weight. Each time about 500 ml of fluids is passed into the funnel head at a level higher than the body. The fluid enters by gravity. After 15 to 30 seconds, the funnel end is taken lower than the level of the body, when fluid from the stomach will come out due to siphon action. The process is repeated till the color and nature of ingoing and outcoming liquid fluid is the same. For whole procedure, about 10 liters of the fluid is required. Other specific fluids used for gastric lavage are 5% sodium bicarbonate in acidic poisoning, 4% tannic acid in strychnine poisoning, 25% sodium thiosulfate in cyanide, iodine and arsenic poisoning, 1% calcium gluconate in oxalate poisoning, 1:2 castor oil in warm water in carbolic acid poisoning, 2 gram per liter desferrioxam in iron poisoning, fresh ferric oxide in arsenic poisoning. To take care of the poisons that escaped gastric lavage, one of the following can be left in the stomach: KMnO4 solution, demulcents, sodium or magnesium sulfate as purgatives, sodium bicarbonate, activated charcoal. The tube should be pinched and then removed. In children, gastric lavage is done using Ryle's tube or rubber catheter using 20 to 50 ml syringe to push in or take out the fluid. 30 centimeters length is necessary to reach the stomach. Complications are rarely seen. If yes, it is aspiration pneumonia, vomiting, injury to mucosa of GIT, or rarely perforation. Second method as the treatment of poisoning is use of antidote. Definition: antidote is defined as a substance which counteracts the deleterious effects of the poison without itself being harmful to the body. Indication: antidotes are used for where emetics and gastric lavage are contraindicated. Poisoning by routes other than oral, the poisoning that escaped gastric lavage. Emesis: the already absorbed poison. Types of antidote: physical or chemical, pharmacological or physiological, chelating agents, universal antidote, household antidotes. Physical or chemical antidote. Definition: they are defined as the antidotes which physically hinder the absorption of the poison. Mechanism of action and examples: demulcents, oil, example oil, butter, ghee, milk white, white of egg, milk of magnesia, starch solutions, and aluminum hydroxide gel. These substances form an oily layer on the gastric mucous membrane so that absorption in the stomach does not occur. Demulcents are contraindicated in phosphorus, phenol organophosphorus, and kerosene poisoning, as these are soluble in oily substances. Bulky food, example banana, flour suspension, boiled rice, or mashed potatoes. These substances engulf the poison and make it non-available for causing effects and for its absorption. Activated charcoal, these absorb the poison, example metal alkaloids and glucosides, and thereby makes it non-available for absorption. It is given 1 to 2 grams per kg body weight using 8 ml diluent per gram. Chemical antidotes. Definition: these substances chemically react with the poison and thereby alter its physical nature. Mechanism of action is an example: certain substances react with poison and renders it inert. Example: weak alkalis for acid poisoning, weak acids for alkali poisoning, calcium carbonate for oxalic acid poisoning, sodium formaldehyde, sulfoxylate, and mercury poisoning. Tannin, obtained from strong tea, forms a complex and precipitates metals, alkaloids, and glucosides. KMnO4 and weak solution of iodine oxides oxidizes the poison. Pharmacological antidotes. Definition: these are the substances which have a pharmacologically opposite action as compared to the poison. Example: it includes certain substances which opposite pharmacological action: chloroform for strychnine poisoning, ethyl alcohol for methyl alcohol poisoning, N-acetylcysteine in paracetamol poisoning, naloxone for opium and morphine poisoning. Immunotherapy. Example: digoxin antibodies and snake antivenin. Chelating agents. These are the substances which are used in the metal poisoning. They form a non-ionized complex with the metal ion so that the metal ion is not available for absorption and thereby cannot affect the enzyme system of the body. Examples of chelating agent: British antilucide BAL, EDTA, CaNa2 EDTA, cupramine, DFM. BAL, that is British antilucide. It is effective in arsenic poisoning. BAL is a liquid and it is given as a 10% solution in arachice oil or peanut oil with benzyl benzoate in the dose of 3 mg per kg body weight. Given deep intramuscularly in the gluteal region, 4 hourly for the first 2 days, 6 hourly on the third day, and till 12 hourly till the 10th day. It cannot be given intravenously for danger of causing embolism due to arachis oil. It is given deep intramuscularly since otherwise it would cause irritation, necrosis and abscess. Contraindication and complications: liver damage, hypertension and tachycardia. EDTA, ethylene diamine tetraacetic acid. Other forms: calcium disodium editate, disodium editate. It is effective against lead, mercury and copper poisoning. It is used specifically against lead poisoning as EDTA depletes serum calcium. CaNa2 EDTA is better, given either orally 1 gram BD for 5 days, IV 5 ml or 50% solution BD for 5 days. Contraindications and complications: renal damage, cupramine or penicillamine. It is a degradation product of penicillin. It is effective against copper, lead and mercury poisoning. It is used specifically against copper poisoning. It is also effective in Wilson's disease, that is hepatolenticular degeneration and cystinuria. It is given orally 30 mg per kg in 4 divided doses for 5 to 10 days. Complications: almost non-toxic prolonged use may cause thrombocytopenia, agranulocytosis, skin rashes and nephrotic syndrome. DFM, desferoxamine desferal. It's effective against iron poisoning. It is given orally 8 to 12 grams per day or intramuscularly or intravenously 2 to 3 grams per day. DFM is also useful in hemochromatosis and thalassemia. Complications: its adverse effects are allergic reactions, abdominal pain, loose motions, cramps and fevers. Universal antidote, very important short note. It is known as universal because it can be used in all cases of poisoning, especially when the nature of the poison is not known. Universal antidote is given 15 to 30 grams orally. It can be repeated 12 to 24 hourly. Some universal antidotes are constituent. Some constituents of the universal antidote. First, charcoal, obtained from burnt bread or toast. Percentage used 50%, parts used 2 parts. Actions: it absorbs the poison. Next constituent, magnesium oxide MgO, obtained from milk of magnesia. Percentage used 25 and parts used 1. Actions: it neutralizes the acid. Constituent third, tannin, obtained from strong tea. Percentage used 25 and part used 1. Action: precipitates metal alkaloids and glucosides, neutralizes the alkalis. Last one, but not the least, household antidotes. That is the substances which are available usually in the house and can be used as antidotes in the case of poisoning. Example: milk orally is effective in almost all ingested poisons. Charcoal from burnt bread or toast. Flour suspension can engulf or even absorb the poison. Banana, potato and demulcins as physical antidote. Common salt or mustard powder as emetic agent. Starch solution for iodine poisoning. Milk of magnesia soap solution, toothpaste, wall scrapings for acid poisoning. Vinegar, lemon juice, orange juice for alkali poisoning. Elimination of absorbed poison. It is done by purgation catharis using 30 grams of sodium sulfate or magnesium sulfate in 4 ml per kg, magnesium citrate or 50 ml sorbitol. Forced diuresis using furosemide or mannitol infusion. Increased sweating, diaphoresis. Hot applied or injected pilocarpine 5 mg subcutaneously. Stimulating metabolism in liver, peritoneal dialysis, hemodialysis, hemoperfusion, exchange transfusion, and whole bowel irrigation. Symptomatic treatment: morphine, pethidine, or Fortrin for pain, IV fluids for shock, blood for oligemic shock, artificial respiration and oxygenation, cardiac stimulants, noradrenaline drip for peripheral and circulatory failure, atropine in abdominal pain, luminol or diazepam for convulsions and restlessness, sodium or potassium for electrolyte imbalance, anesthesia in convulsions, adrenaline, antihistaminics and steroids in anaphylactic reactions. Fifth one, general care. Warmth is given to the patient, good nursing care is given, prophylactic antibiotics, physiotherapy for rehabilitation, and psychotherapy in attempted suicides. Thank you.